Welcome back to Life and Living. We're talking all about yoga, one of my favorite things, but yoga for people who are struggling with illness. I'm joined in the studio right now by Dr. Minaxi Jhawer. She's a hematologist-oncologist and director of gastrointestinal medical oncology at Englewood Hospital and Medical Center. Welcome, Dr. Jhawer.
Thank you for having me.
You know, I love talking about yoga because I know the benefits that it's had in my own life and in the friends that I have who practice. And so I love hearing about a program like this that you're bringing to people who are struggling with cancer. Tell us how the program started at Englewood.
It's an interesting story because I had a patient who was a survivor of triple-negative breast cancer.
I'm sorry to interrupt you, but what is triple-negative breast cancer?
It's a rare type of breast cancer, but a very aggressive type that affects probably a younger population. And it doesn't make specific receptors where you could target the therapy and give specific hormone therapies after the standard treatments are over. So these are the patients that after surgery and chemotherapy really don't have a hormone or anything else to target and treat them with.
So does that increase the risk of it coming back?
It could increase the risk of the cancer coming back. And so when one of the survivors asked me, you know, what else can I do? What can I proactively do to reduce the risk of the cancer coming back? I was somewhat stumped because we were done with the traditional medicine and we had, you know, achieved all our goals there, but I wanted to do more. And so that triggered my interest in being able to provide that extra integrative medicine at Englewood Hospital for this cohort of patients. So we actually were very grateful to the Triple-Negative Breast Cancer Foundation, who were able to grant us for the year's worth of free yoga programs with a yoga certified teacher, and we were able to provide the mats and the blocks and all the other accessories to get them going.
How was yoga the answer for you? How did you make that connection? When she said, what can I do? And you said, I want to help. How did yoga become the answer?
I think there's clearly data on breast cancer patients that doing yoga after you're diagnosed reduces the risk of the cancer coming back. There is a tie between stress, cancer, and I think yoga is a way to de-stress. And it increases your flexibility, oxygenation. It helps to, reduces the bad emotions and hormones that come thereof from that. So I think it just improves the overall sense of well-being. And there's data which shows that it reduces the risk of cancer. So I think it was almost like a no-brainer that we should have these for our patients and make it easily available for them. And that's why we had it start at Englewood Hospital.
And what was the feedback? I mean, you had this one young woman who was really eager and wanted to do something for herself. When you offered it out to the community, what was the feedback from your other cancer patients?
Yeah, I think it's a great question. There was an overwhelmingly positive response. Patients poured in with triple negative. They loved the program. They continued with it. We actually had a Spanish-speaking teacher as well, which was really good for a cohort of patients who were really Spanish-speaking only. So they felt very comfortable, engaged. And they also developed a group of people they could fall back on with the same diagnosis.
So it became a little bit of a support network.
Yes, absolutely. So it served both purposes, you know, of giving them an activity to reduce the risk of cancer coming back and emotionally connecting them to people they could relate to.
And now the program is expanding.
Yes, so I think after that 1 year, we were so thrilled and we expanded it to all cancer patients. And we expanded it to caregivers and to other cardiothoracic surgery and cardiology patients because I think it's applicable in different fields. It shouldn't be restricted to just specifically triple-negative breast cancer.
What are you learning through this process about the health benefits of treating the patient not just before and not just during, but after their diagnosis and their treatment and their therapy?
I think what we are learning is that they're able better to cope with the different aspects of the treatment when they're going through treatment. And they feel a little bit more relaxed and easier to make it through that period. And they feel that they're more proactively involved. They're doing something actively. I mean, we can do the surgery, we can do the radiation and the chemotherapy, but they are actively taking care of their own health.
This is a way to take charge of your own health in a preventive way. Many of these people have already come through a lot, but to prevent anything further.
Absolutely.
Let's talk about the new Graft Center for Integrative Medicine that just opened up. What is that center and what is its mission?
So because of the increased demand of the cancer patients, almost an 80% increase in demand, we opened a huge cancer center. And
in other words, let me just clarify what
Yeah.
you mean by that. There is an increased population in this area in New Jersey who have need
required
for
cancer care.
treatment.
Absolutely.
Because cancer is spreading.
Absolutely.
And we're finding it in different ways, right?
Exactly. So we needed to meet up with those needs and demands, and so we were able to open up a beautiful, huge cancer center which met the needs of the patients from diagnosis to treatment, the surgeons, the medical oncologists, radiation oncologists, all within a small area, so they can connect and discuss the care of the patients and coordinate the care. And the infusion center where they get the treatment is right there. But it wouldn't be complete without a wellness center.
Yes.
So on the same floor, we have the Graft Center for Integrative Medicine. And it's a beautiful, serene, spa-like setup, which is going to start up. And we're going to be able to give patients the advantage of trying yoga, Reiki, massage, a lot of different aspects that need to be integrated with the care for cancer.
A lot of holistic approaches, it sounds like.
Absolutely.
And so how is this, how is it for the patient when they can come to one location and they can see both the clinical professionals as well as the more holistic professionals who can approach their illness kind of from a multidisciplinary approach? What does that do for them?
I think that's the way it should be done for them, and I think this is a huge change and transition that we're seeing all over, but we've been fortunate at Englewood to actually have it all under one roof. And I think it gives them more complete care. It aligns with mind, body, and soul care, where we're really connecting everything together to get the best outcomes. So I think having it under one roof, having it under one area, with everyone connecting and discussing cases, makes it really easy.
Well, we thank you for the great work that you're doing. We will look to you to see what else you are able to bring to this community, and we'll be doing some yoga classes, thinking of you as well. Dr. Minaxi Jhawer, hematologist-oncologist and Director of Gastrointestinal Medical Oncology at Englewood Hospital and Medical Center. Thank you so much.
Thank you so much for having me.
Don't go anywhere. Life and Living is coming back right after this.
Life and Living has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence, and NJTV. Funding for this edition of Life and Living with Joanna Gagis has been provided by University Hospital, Newark, New Jersey Sharing Network, PSE&G, MagnaCare, Wells Fargo, the Russell Berry Foundation, and by United Airlines. Life and Living with Joanna Gagis has been produced in partnership with St. Joseph's Healthcare System.